All right, we will get started. Good evening, everyone, and thank you for joining us for this IDF Forum, Zebras Fit for Life, session 1 of 3. My name is Alyssa Creamer, and I'm the Director of Community Services at IDF, and I will be your host for this evening's forum. Before we begin, a quick disclaimer that the information presented during this event is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with questions concerning a medical condition. On behalf of the Immunodeficiency Foundation, welcome. And whether this is the first time you have attended an IDF forum or have joined us before, we are so honored to have you with us tonight. IDF's mission is improving the diagnosis, treatment, and quality of life of people affected by primary immunodeficiency through fostering a community empowered by advocacy, education, and research. This means we are committed to serving you and providing you with the tools and resources needed to be your own best advocate and a champion for the PI community. It is by offering these tools and resources that IDF can fulfill its vision of seeking to ensure that everyone in the United States affected by PI has a fully informed understanding of the PI diagnosis that affects them, all available treatment options, the expected standard of care, and all of their opportunities for connection and support within the PI community. IDF forums are made possible by our wonderful sponsors. It is due to their partnerships and contributions that IDF is able to provide programs such as this one and services to everyone in the PI community. Thank you to our 2021 sponsors: Core Services Leaders, CSL Behring, Grifols, and Takeda; Core Services Supporter, Horizon Therapeutics and Octapharma; Core Services Sustainer, Accredo; Core Services Contributor, ADMA Biologics Bioproducts Laboratory, Farming Healthcare, and X4 Pharmaceuticals; National Patron, Kedrion Biopharma; and Community Partner, Solio Health. IDF Get Connected groups provide an opportunity for individuals in the PI community to meet virtually in a small group setting. They are held nationwide throughout the year and are a great way to meet others living with PI. We also have several upcoming forums this August, including Navigating Access to Healthcare, Communicating with Your Healthcare Team on August 12th, and sessions 2 and 3 in this Zebras Fit for Life series will take place on August 19th and again on September 2nd. For more information and to register, you can find out details on our website, www.primaryimmune.org/events. I would now like to welcome Angela Reidner from our WALK team, who would like to share some exciting WALK for PI updates with you all. Angela?
Thanks, Alyssa. Hi, everyone. So I'm very, very excited to share that our IDF WALK for PI season is getting ready to gear up. You definitely want to register. You want to register at www.walkforpi.org, and I will put the link in the chat. So to register, you just, as I said, go to www.walkforpi.org, and registration is free. So who doesn't like it if it's free, right? So, and for everyone who registers, you get an awesome Walk for PI t-shirt for our kickoff next Saturday. So just go to the WALK website, www.walkforpi.org, to register as well for the kickoff. And then we have lots of great new and exciting things this year. All you have to do is show up. You can walk. You can do another donation for a walk in the box. We have an education workshop to help teach you how to fundraise, even if you're a little uncomfortable. So you definitely want to check this out. You want to sign up, and it's a great opportunity for not only great camaraderie with your other PI family, but also just a great time to raise money so that IDF can continue its fabulous mission. Thank you so much, and back to you, Alyssa.
Thank you, Angela. I would now like to welcome and introduce our presenter, Dr. Linda Csiza. Dr. Chiza earned her Bachelor of Science degree from Texas Women's University. She earned both her master's degree and Doctor of Science degree in neurology from Rocky Mountain University of Health Professions. Dr. Chiza has worked in many physical therapy settings and had the opportunity to work with people with orthopedic injuries and surgeries, people with neurologic conditions, multiple sclerosis, Parkinson's disease, dementia, stroke, spinal cord injury, myasthenia gravis, Huntington's disease, amyotrophic lateral sclerosis, vestibular and balance deficits, and pediatrics with many different diagnoses. She is taught in the entry-level physical therapy programs at the University of Colorado and Texas Women's University. Her content area was neurology and neurologic diagnoses. After retiring from teaching, Dr. Chiza now works for her professional organization, the American Physical Therapy Association. She is the lead accreditation specialist for residency and fellowship education. So please join me in welcoming Dr. Chiza.
Well, I'm happy to be here and excited to speak to you all about this topic, which is really close to my heart. I do want to let you know that my Doctor of Science degree is in neurology, but I'm not a medical doctor. I'm a physical therapist with an expertise in neurologic physical therapy. I'm also a board certified neurologic physical therapist. So I want to talk about the importance of physical activity, and I'm not going to use the term exercise, because when I say exercise, people cringe and want to turn away because so many people have had challenges with exercising across their life for various reasons. Most often it's because they haven't been educated or they were trained improperly in how to best exercise for their body and their own physical conditions. So the talk that the information I'm going to be giving you tonight is from healthypeople.gov. In 1997, the Surgeon General published a paper on health prevention and promotion. This started the movement in America to start looking at how we're living and what diseases we're faced with and how we can maintain a long, active, healthy life. Well, in Healthy People 1990 arose from that, which was promoting health, wellness, and education, health, wellness, and prevention for people. Then came Healthy People 2000, which was a national health, it consisted of national health objectives on maintaining health, wellness, and preventing disease. Healthy People 2010 took those objectives and moved them forward and started looking at where are some of the disparities that we as Americans face in our lives. Healthy People 2020 resulted with further objectives, and that area in this guideline, there were specifics related to fitness, wellness, health prevention, and physical activity, including physical activity for people with chronic diseases and disability. We're now in the realm of Healthy People 2030, where the objectives that were not accomplished in Healthy People 2020 are moved into Healthy People 2030, and other areas of disparity have been identified and are going to be addressed. So the importance of physical activity as reported in the Healthy People documents is that physical activity can help achieve and maintain healthy weight, reduce the risk of heart disease and stroke, reduce the risk of certain forms of cancer, strengthen muscles, bones, and joints, and improve mood and energy. So what is physical activity? Well, physical activity is a lot of things, and we're going to talk about what constitutes physical activity, but I'm going to tell you what the guidelines recommend. The guidelines recommend for all adults, whether in an excellent state of health or like those of us who are attending this forum have chronic health issues that we we've been dealing with for a long time and will be dealing with for the rest of our lives. So the recommendations are 150 minutes of moderate intensity physical activity per week. So that could be 50 minutes 3 times a week, 30 minutes 5 times a week, and I calculated out how many minutes 6 times a week, and I've forgotten the number, so I can't give that to you. But essentially, it's not a lot of time of physical activity. And again, I'm purposely not using the word exercise. So according to the guidelines, physical activity that is 10 minutes in length counts towards those 150 minutes per week. There's also a recommendation that people who do 75 minutes per week of vigorous intensity or an equivalent combination of vigorous and moderate intensity physical activity will meet the required standards. So what types of physical activity do they speak about in the guidelines? They speak about muscle strengthening activities, aerobic activity, balance, flexibility, although flexibility was not included in the guidelines, and I'm not sure if it's included yet in the 2030 guidelines. And it's recommended that these activities be conducted 2 or more days a week. Muscle strengthening activities, which can include weights or body weight activities. These types of activities actually burn 2 to 3 times more calories than other activities and don't often have to be done for as long of a period of time. They also have been found to increase bone mineral density, which is something I'm always concerned about because I am osteoporotic. Aerobic activity is recommended, and the definition for aerobic activity is where your heart rate is roughly 220 minus your age times 0.8, which is an 80% aerobic intensity level. So now we need to talk about what is moderate physical activity. So I've got some examples up here. Walking 3 to 4 miles per hour. Now I say that this is based on an average healthy individual person. Usually it's an average healthy individual male. Well, I'm not average, I'm not healthy, and I'm not a man. So walking 3 to 4 miles for me at this point in my life, with the conditions that I'm carrying in my backpack from my primary immune deficiency, would be a pretty fast pace. And that would be more for me at a vigorous intensity. So you need to look at these activities as they're listed on here and understand that they have been described in healthy, active adult males. Cleaning, vacuuming, and mopping and washing windows are considered moderate physical activities. Well, for some people, including myself now, those activities would be vigorous. Mowing the lawn with a power mower, that would be vigorous activity for me, where for my husband, it is moderate activity. Bicycling, light effort is considered moderate. Badminton, tennis, doubles, or pickleball, which is played in a doubles context. Speed shopping, my oldest daughter and I have mastered the art of speed shopping. I now can no longer keep up with her, so I consider that to be vigorous. Running errands for a period of time. Let's say you have to go to the grocery store, and then you have to go to the pharmacy, and maybe you have to go by the dry cleaner. All of those activities count as moderate physical activity. So what is vigorous activity? Well, I've described some of the things that have become vigorous for me now as I've aged and as I am dealing with more health conditions that I did 10, 15, 20 years ago. Hiking is vigorous, jogging, shoveling, things like snow, especially, carrying heavy loads, bicycling fast, a basketball game, soccer game, and tennis singles. Most of those things, I can hike, but it's going to be a slow hike now. The rest of it, I can no longer do. So we're going to talk about some of the activities that fall under the category of physical activities. Strength training can involve weights. I have visual aids here. This is a 1 pound weight. It is a 16.5 ounce can of beans. This is 1 pound. Everybody has a 1 pound can of something in their cabinet, in their pantry. This is a 1.3 ounce can of soup. So here's another weight. You can hold on to a 2-pound bag of rice. So I've just shown you 3 different weights of things that you have in your house. Body weight, activities like going sit to stand and holding that position for 2 seconds, or holding 2 soup cans in your hand is a great activity to strengthen your muscles. Heel raises, where you stand and you come up on your toes. I can only do that on 1 foot now. I can't do it on both, so that's a hard activity for me. Lunges are challenging. You can do the lunges holding on. You can do modified lunges. You can do mini lunges. Yoga and Tai Chi are great activities too, and there are classes available both in person and online. And our third class in this series that we're doing is going to be an adaptive yoga class that is taught by a certified yoga teacher from a chair. So you're telling me you haven't exercised in a long time. Well, you don't need a gym. You don't need to join a gym. In fact, going to a gym and working with a personal trainer, I can tell you they don't know who you are and what you have in your backpack that you're carrying unless they have special training. Most personal trainers don't have special training. I have a really good friend. His name's Travis Earhart. He'll be with us on the 3rd session. He owns a personal training gym called Mindset Fitness and Yoga. His gym for the past many years has been dedicated to promoting health and wellness in people who have MS. And he was doing it for several years. And I partnered with him because I was using his clients for some of my research studies. And he asked me to train him and his personal trainers on how best to work with somebody who has a disability. So I had the opportunity to work with all of his wonderful personal trainers and show them how they can best work with somebody who has physical differences. And so his is the only gym that I trust sending any of my personal PT clients to, the only gym that I will myself go to, because I know he has the background, the equipment, and the resources if he has questions to be able to work with somebody. It's really difficult for us to go to a gym and ask a personal trainer to develop a plan because we're not healthy, we're not strong. We have to start way, way, way back from where somebody else our same age level might need to start. You don't need equipment, as I said, to exercise. You don't need massive amounts of time. You can do a great exercise workout program in 20 minutes or less. You do need to start somewhere. So what I would like everybody to do, so I want everybody to stand up. Then I want everybody to sit down. And I want everybody to reach up high. And if you can't stand up, you're just going to reach up high when I tell you to stand up. So everybody's doing okay, right? People have to stand up to do activities during their day. Okay, well, let's wait. I forgot something. Stand up, reach up high, sit back down. Okay, wait, stand up again. Sit back down. I keep forgetting. Stand up, sit back down. All right, so I'm going to say what I always used to tell my clients in the clinic. One more time, stand up and sit back down. So you have just done my favorite exercise, a sit to stand or a modified squat. You've just done physical activity. Everybody stands up and sits down during the day. So the way that I often have people start is I tell them, every time you have to go to the bathroom, you're going to stand up 5 times before you go to the bathroom. So you better plan ahead. Once you feel comfortable doing this, you add a soup can to your hand, or you add 2 soup cans, 1 in each hand. So now you've made this body weight support exercise a little bit more demanding. Not only can it become aerobic training, but it can become strengthening and balance training. Walking is one of the best activities that anybody can ever do. So let's say people are so fatigued and just haven't done any physical activity like this in a long time, you can start in your house. You can start by going for a 5-minute walk in your house, resting, doing whatever you're going to do during the day, and going for another 5-minute walk in your house. If you can build up to doing that 3 times a day, you've got 15 minutes of walking. Now, I can tell you that when you're walking, after you sit down, your heart rate doesn't just go right back down to its normal level. So you're getting the benefit of the physical activity, even though you've only walked 5 minutes. Walking 5 minutes is a good way to start. Let's say you're a community walker and you're able to go out and do some walking. So you could start with a 10 to a 15-minute walk at your own pace. You're not racing anybody. You're simply walking around your neighborhood at a comfortable pace. Remember, as far away from your house as you go, you have to go that far to get back. So I have people time. If you're going to go for a 15-minute walk, you can only go 7.5 minutes away from your house. I sometimes tell people to start with 10 minutes because it's easier to do 5 and 5 than 7.5. If this goes well for you, then within a week or so, you can try to add a second walk to your day. Let's say you do a 10-minute walk in the morning, and then you do a 5-minute walk in the afternoon. You do that for a week. After that period of time, after a week's period of time, you're still feeling okay, you can either start to extend your 2 walks, go from 10 minutes to 12 minutes, and your second walk from 5 minutes to 7 minutes, and do that for a week. So that's a way to start a walking routine. Doesn't matter if you're walking a mile or not. It doesn't matter if you're race walking. What matters is you're going out and you're doing something. You want to try to build your tolerance up to a 30-minute walk if you can. Great activities for you to do are to move your arms up over your head or to your side. Anytime you move your arms, your heart rate goes up higher than when you move your legs. So if you want to get your heart rate up, you can just reach your arms way up over your head, bring them back down. You can reach your arms out to the side and bring them back down. You can reach over to one side and up over your head and back down. And you can do this for a short period of time. I want to caution you that exercising your arms may appear to be fairly easy, but you don't want to go for too many minutes because your arms will be sore. The goal is to complete physical activities without making your body really sore. So here are some activities I've put on the slides that you guys can try to do in your own home. You can stand and reach forward and sideways and rotate and reach behind. So reaching forward is like you're reaching for something in the cabinet. Reaching sideways is similar, but you're just reaching straight out to the side. Marching in place is a great activity to do. You can start by doing 10 steps, and you're trying to think, I'm going to get my knees up as high as I'm comfortable with my own balance and my own endurance. If you can't march in place and feel comfortable in standing, you can hold on to a counter, the back of a chair, the back of a couch, and march in place. You start with 10 steps. You do it once a day. Then you gradually build up to where you can do 100 steps. You can also do marching in place and sitting. If you just can't get up, if your body is not allowing you to get up and move in the way you want to, you can march in sitting using the same parameters. Another great activity, if you have stairs or on a large book, I used to say a phone book, but we don't have phone books anymore. So for me, it's my old textbooks from my college days. You can do a step touch on the book. So you step and put your right foot on the book and step down. You put your left foot on the book and step down. You do that 10 times. That's the first part of this exercise. When you can also do this on a stair where you're just putting your foot up on the stair and taking it down. The next level would be stepping up onto the book or the step and then stepping down, alternating your feet. You do that 10 times. And you can build up this activity to where you're doing it maybe 10 to 15 to 20 to 30 times. If you have stairs, and stairs are the hardest things in the world for me to do. And I live in a 2-story house. So you can go up and down a flight of stairs, holding onto the rail if you need to. There's nothing wrong with that. And do it one time. And do that for maybe 2 weeks. And then the next time, see if you can go up a flight and a half. So you go up one flight, you come down, you go up half a flight, turn around and come back down. And you can build up to doing 10 laps of stair climbing, which is excellent exercise. It doesn't have to be fast. You can hold on to the rail. You do it at your own speed and at the time of day that it's best for you. So balance activities are really important. And I have to share with you that my balance is not very, very good right now. I have damage to my right leg from fluoroquinolone toxicity. I've had 2 fractures in my foot over the past year because of the osteoporosis, and my right leg is just really weak. So my balance is bad. So starting off balance activities, you stand with your feet together with your eyes open for 30 seconds. If you're comfortable closing your eyes, try to close your eyes. You want to focus your attention on what your feet and ankles are doing. You're swaying over your feet and ankles, and that's normal. That activity helps keep us balanced. If you can't stand with your feet together and feel safe, you can put one finger on the counter in front of you and then count to 30 as you balance. Gradually, you're going to be able to take your one finger off the counter and balance on your own. A second level is to stand with one foot in front of the other. That is what the images of B, C, and D are showing you. B is the easiest, D is the hardest. I don't have people start doing those activities until they're really comfortable standing with their feet together. Single leg stance is where you try to stand on one leg. I can only stand on my left leg. I cannot stand on my right leg. I can't hold my weight for anything more than 2 seconds. So dynamic balance activities, walking is one of the best dynamic balance activities. And I've already told you about that, but you can do other sorts of walking activities. You can walk 10 steps forward and then walk 10 steps backwards. Walking backwards is a whole different challenge for your body and your brain. It's a great activity. You can walk forward with your eyes closed. I suggest doing this in a hallway where if you kind of veer off track, you're going to bump into a wall, which will remind your brain that you've got to stay balanced. You can do a side step right and a side step left. So you step to the side, step to the side, step to the side, and do 10 steps. And then you go back. You can dance. Just turn on the music and dance as if no one's watching. You can dance with a partner. I have a basic rumba box step, which is what I teach people in what I used to teach people in my clinical practice. And it's just showing you how to move side to side, back and diagonally, so that you can use your balance in a dynamic way. Another activity that I like to encourage people to do is to start from sitting, stand up, walk 3 steps, turn around, walk back to the chair, and sit down. You've just gone sit to stand, my favorite activity of all times. You've walked 3 steps and turned, which is a great balance activity. You've come back and turned, and then you sat back down. Other activities that you can do dynamic stretching like yoga and Tai Chi. Those are great activities. You can do isolated stretching. So I've got 1, 2, 3, 4, 5 images on this slide of isolated stretching. The first is called the cat and the camel, where the woman has her back sagging is the cat. Where she's pushed her back up, that's the camel. The second one on the top right of the images is called child's pose, and it's from yoga, where you sit back on your heels. It takes some people a while to be able to get to where they can sit back on their heels like that. So there are ways that you can start this activity without doing the full activity. The next image that I've shown is a calf stretch, where you put your hands on the wall and you put one foot in front of the other, and you try to keep your back heel on the floor and bend your front leg slightly, and you'll really feel a strong pull in your calf muscle. So that's one of the leg stretches. Arm stretches, I've shown you two here. One where you cross your arm across your body and then push gently on your shoulder. And the other is arms over your head and just doing like a really good stretch to wake up your upper back. Neck stretches are fairly simple, just looking right and left slowly, up and down gently, and trying to bring your ear to your shoulder, which for many people is challenging. The benefits of physical activity are many. It has been shown to decrease mortality by 35%. Physical activity is medicine. Exercise is medicine. And by the way, did you know that sitting is the new smoking? My job that I now have with the APTA, I sit in front of a computer all day long. So I have to really make an effort to get up and move around during the day. I drink so much water that that's not a problem. I have to get up and go to the bathroom multiple times during the day. Physical activity has an impact on cognition and memory. It can increase your lifespan. It can improve your overall well-being, improve your overall mobility, lower your blood pressure and improve heart health. It can improve quality of sleep, and it can reduce feelings of anxiety and depression. I do want to let you know that our next session is going to be an active participation session where we're going to do a virtual physical activity program. We're going to do some stretching. We're going to do some weight training using cans or not. We're going to use some aerobic activities, and we're going to do some balance activities. So I'm going to take you through a lot of different techniques that you can do at home that are really simple to do. The important thing to remember is you know your body better than anybody else does. So you need to learn how to best perform physical activity where it doesn't cause you stress, strain, or harm. And one of the ways that you can do that, because so many of the issues that we deal with and face every day are energy draining or cause fatigue. So one thing that I've had to learn, even though I teach it or taught it to my clients every time I worked with anybody who had a disability or a chronic illness, is the concept of energy conservation. We need to know when our high energy times of the day occur. We need to know the tasks we need to do in a day. We need to know which ones of those tasks are the most energy draining. We need to identify in our lives what things can cause us problems. For me, it's the heat and the humidity. It's also weather changes. It's how well I've slept the night before and whether or not I have any significant infections in my body at the time. By the way, physical activity has shown to help to decrease the time that it takes to recover from an infection. You just have to do it the right way. So this is kind of my introduction to physical activity. And I would like to thank you for your attention, and I would love to answer questions now.
Great. Thank you, Dr. Chiza, so much. We so appreciate all the information that you were able to share with the PI community. All right. So again, thank you to so many for submitting all of your great questions. Our presenter, Dr. Chiza, will answer as many as possible during this time allotted to us. So Dr. Chiza, let's just jump right in. I have a couple of questions that were submitted beforehand. Do you have any recommended stretches or exercises for those with spinal stenosis, sciatica, or intense low back pain, and helping people find ways to avoid being sedentary without causing more pain?
That's a really good question. There are quite a few stretches that you can do. Spinal stenosis, the best stretches for spinal stenosis involve flexion or bending forward. So one easy to do exercise for spinal stenosis is even just sitting in the chair, bending forward in your chair and letting your back gently stretch in a flexed position, holding that for maybe 10 seconds. You don't want to push anything really hard, or you're going to cause pain in the muscles and possibly the joints. Sciatica is a little different. That often feels better when you put the body into full extension or when everything is completely straight. So if possible, either lying on your stomach, flat on your stomach for maybe 10 seconds, because that can be a challenging position for a lot of people, or lying on your side with your body straight to straighten out all the joints can help ease the sciatica. But there are more types of exercises, stretches that we can do for those conditions. And I'll try to remember in our virtual physical activity session to have you try some of the stretches for the back for different conditions and problems.
Thank you, Dr. Chiza. Other people are wondering how patients can cope with post-exertion fatigue after doing many of these activities. Do you know how they can cope and why it occurs?
So one of the reasons, and this is my theory, I haven't looked to the literature about this, but one of the reasons that I think occurs is that people are guided to over-exercise. So a normal exercise class for people without the conditions that we have and face every day is way too much physical activity for us. We might be able to build up to it, but it might take years to build up to it. So the best way to cope with overexertion is to prevent it from occurring. So you start slow. You start at a very low intensity with very gentle sorts of activities. And it may feel like you're not doing much, but you are. You're doing what your body can tolerate. And within a certain short amount of time, then you can make the exercise, the physical activity, a little bit more challenging so that it still doesn't drain you of your energy. And again, it's that energy conservation concept too, where you need to figure out how often can I exercise in a week? What are my best times to exercise? If I exercise, am I going to have to give up something else during the day? So there's a lot of consideration that needs to be taken to develop a good exercise program. And I'm going to plug my profession. Physical therapists are the best people who can help somebody just learning how to exercise to begin exercising in a safe and effective way. And anybody who has a primary immune deficiency can get a prescription from their doctor. And finding a good physical therapist is pretty easy. You can go to apta.org and do find a PT and put in your area, your zip code, and it'll pull up PTs in your area. And you really want to look for somebody who deals with chronic conditions. Doesn't have to be an orthopedic physical therapist. It can be a neurologic physical therapist. It can be a geriatric physical therapist. Those physical therapists with specializations generally have more knowledge and understanding. So those are some of my suggestions.
Thank you. I'm sure many in the audience don't realize that a PT could be one of the best things they could do.
That's right.
We have another question from the community who says, all of these suggestions and adaptations are great. However, I have vertigo, frequent nausea, and use a walker and frequently fall. To me, some of these things seem so unattainable. Do you have any suggestions for moving besides just trying?
Yes, I do. For this person specifically who asked this question, I suspect that they have a vestibular dysfunction and should really go see a physical therapist who is a neurologic clinical specialist. They are located throughout the country. I am happy to try to help find an appropriate physical therapist for this individual. I would just need the information of where they live. They're not their specific home address, but their zip code, and I can search for a PT that would be appropriate to help the person with this. I also have a vestibular dysfunction, and there are times when I can fall. I just fell a couple of weeks ago, and I don't believe it was from I really don't believe that it was from my vestibular dysfunction. I think it was from the myasthenia gravis. So vestibular dysfunctions can be rehabbed, and then people can get back to a much more normal life, doing the things that they want to do, perhaps without a walker.
Thank you. Another individual is asking, how do you jumpstart yourself when you are fatigued, emotionally overwhelmed with no energy, and get yourself to do even simple daily stretches when you live alone and have no other support system?
That's a really, really good question. And I think this person, I hope they come back for the third session when we do the adaptive chair yoga, which will be done virtually and is offered through an online format. And I believe the adaptive yoga is offered through the organization free. So that's a great way to start. The yoga teachers are all certified. They've all been trained through it to do adaptive yoga, but that's one way that you can do it. Another way, again, is to go to a physical therapist, have them understand your medical history and to provide for you a very gentle way to start. And again, it needs to be gentle, it needs to be slow, but it needs to be not boring. And that's the trick. So physical therapists should be able to determine an exercise program that will be easy to do, that will challenge your body in a way that is good for you, but is also not boring.
Thank you. Is it okay to do many of these low intensity activities while someone is running a low grade temperature and also on an antibiotic?
I can share with you that I do have infections like many of you, most of the days of the month and the months of the year. I exercise every day. On the days that I feel sicker, I don't exercise as much or as hard. My dogs wonder why we're walking so slow, but they adapt. As long as you respect your body and know your own limitations and know that after you do the physical activities that you're doing, that you're likely going to have to rest more so than you normally do. So it is okay as long as you're gentle.
Great. Let's see, what else is coming in? How do I battle exhaustion that comes with having a PI? I feel like the exhaustion is increasing every day.
I know where you're coming from. The exhaustion may be increasing every day, but the good thing about physical activity is that physical activity breeds energy. If we can get our bodies up and moving in a way that is the safest for us, the best for us, uses the strengths that we have, doesn't overtax our bodies, you're going to find that you have a little bit less fatigue and a little bit more energy. With people with chronic illness like us, we have limited energy reserve. So everybody starts off with a certain amount of energy for the day. Most people who are healthy and normal have an energy reserve. So if they get sick, they can dip into their energy reserve to be able to do what they still want to do even though they're sick. Well, we have a lower baseline of regular energy. Much of the time we may even have a low level of infection. So we're going into our energy reserve just to do day-to-day activities. So again, it goes back to energy conservation, and it goes into doing what we need to do to get started, and then finding things that feed our spirit, strengthen our bodies, but don't tax us in a way that will take away energy, but will actually fill up our energy well a little bit.
Thank you, Dr. Chiza. Someone else is wondering that if they have, it's EDS, which I'm thinking is Ehlers-Danlos syndrome. Are you aware of how to find a PT who is EDS knowledgeable?
The best specialization for a PT that would have some knowledge or education related to EDS would be a neurologic physical therapist. And their specialization will be characterized by NCS, Neurologic Clinical Specialist, after their name. So again, you can go to apta.org, go to Find a PT, type in or search neurologic specialist in your area and see whose name comes up. And then you can start making calls and asking, have you ever seen somebody with EDS? And if not, would you be willing to work with me to help me develop a good exercise program?
Great. We have a comment from someone who is saying that it's so reassuring to know that Dr. Chiza knows exactly how we feel. And this is the best medicine we've had lately. They feel encouraged. So thank you, Dr. Chiza.
Oh, I'm glad to hear that.
Somebody else is wondering if you can offer any simple daily stretches for health and flexibility.
We will do that on our next session in 2 weeks. So I will do stretching, strengthening, a bit of aerobic activity, and balance. So I'm going to try to do stretches for the whole body and then a few of the other activities. I think stretching is really important, and it's a great way to start. So come back next time and you'll get to practice some.
Yes, that's a great plug, because someone is also asking for a PI-friendly stretch and workout that can be uploaded to YouTube. And I just want to say that all of these forums are recorded. So if you join us next time for this part 2, it'll be recorded and it will live on the IDF website. So it'll be a great little stretch and workout for everyone. Let's see, what else is coming in? So someone says that they feel restricted in the amount of energy they can put out, whether it's walking, exercising, housework, or even too much social interaction. They end up absolutely exhausted. Is this an expected response as someone with PI? And I used to be able to push myself, but I no longer can.
You know, I'm kind of the same, in the same boat. I've always been physically active, even though I've always been chronically ill. But in the past 7 years, the autoimmune conditions that I have increased by large numbers, and the infections are occurring more frequently and they're more severe. So I can feel your pain. I do know that when I do things, when I do physical activity, I feel better, even on my worst day. So the key is getting a program that's developed well, adhering to the program, and sometimes it even means starting with breathing activities. Breathwork activities can be really good at relaxing the body and also exercising the lungs, which for me is a really important aspect in my physical wellness. And so sometimes we can start there with breathing activities, leading into gentle stretching activities, maybe going into some simple yoga moves, which will all then eventually build into a very lovely physical activity program that will enhance you instead of drain you. So it is possible to do it. And I don't know for sure if everybody with PI feels the same as you do, but I can say that I do. And I know it's a daily battle to do what we need to do to get done what we need to get done.
Thank you, Dr. Chiza. Yeah, I'm seeing a lot of comments saying that fatigue is a problem for lots of individuals with all types of PI. So everybody is in the same boat, and this is definitely very helpful.
Yeah.
All right, let's see. Another question that I have coming in is saying if you have any recommended accommodations for those with joint issues, rheumatoid arthritis, or osteoporosis, especially.
Yeah, those are my life experiences. I have 3 types of arthritis and osteoporosis, and I'm able to perform physical activities in a comfortable way. In fact, I've found that when I'm not physically active, my joints get really stiff, hot and swollen. When I use my joints and move them gently and in the way that they're designed to move, I actually have a lot of flexibility, which in some ways is good, in other ways is not good. Then I can help to control the arthritic symptoms somewhat. I still have pain every day, but most people don't know I have pain every day because I don't see it. And I'm up and moving and doing pretty much what I want to do. I've had to give up a lot of things, but still moving. So yes, you can exercise with joint issues, with arthritic issues, with inflammation that is happening in your body. And physical activity can help decrease inflammation if it is done appropriately and timely.
Thank you. The only other question I see coming in is, should all of these accommodations or adaptations be done if you are someone who experiences hypotension during exercising, or should additional accommodations be taken?
That's a really good question. For somebody who deals with hypotension, especially with physical activity, just doing normal daily activities, I would recommend, again, finding a physical therapist to help develop that initial program. And it will be done differently. That initial program will start lying on a bed or lying on the floor and doing what we call anti-gravity exercises, which are less demanding on your heart and lungs, which keeps your blood pressure more stable. So it won't cause elevations or decreases in your blood pressure because of the physical activity. You then move from there to doing things in a seated position. And you can get your heart rate and your blood pressure to go up by doing these activities if you're staying in one position. Then gradually, we would move to standing and walking activities. But again, this doesn't happen in a week. It might not even happen in a month. It might take several months to get there. But doing this under the guidance of a physical therapist is a safe way to do it, and it can be done. I have worked with people who have POTS syndrome in the past and successfully helped them to get back into their life. One young woman was rode horses, and she ran with her horses to train her horses, and she wasn't able to do that, and we were able to get her back to doing the things she loved most in life. So it is possible.
All right, thank you so much, Dr. Chiza. That's really all the questions I see coming in. Thank you so very much for your time and your amazing expertise. We know we are going to have you again in just a couple of weeks and get everybody up on their feet and moving and practicing some of these great exercises and stretches and just static movements that you talked about today. And thank you to everyone who submitted their great questions. It really added just to the interaction of this forum. So thank you.
I hope everybody has a good evening. See you in a couple of weeks.
Yes. All right. Thank you again, Dr. Chiza. And thank you so much again to all of our fantastic sponsors. We are so honored that you have been able to join us tonight and share more information about your resources with us and the IDF community. All right. And once again, I want to thank you for joining us tonight. I hope you found the information presented to be very helpful. Please remember that IDF is here for you every step of the way on this journey. We will see you again soon on August 12th with Navigating Access to Healthcare, Communicating with Your Healthcare Team. And then the next session in the Zebras Fit for Life with Dr. Chiza will be August 19th. And the third one will be September 2nd. And like we said, everyone will be getting up on their feet and finding ways to adapt exercises and stretches for ways that fit them and their health. So you can find more information and register online at primaryimmune.org/events, and we will see you then. And you can always catch all the recordings of our sessions on the IDF website and YouTube, again, on our website. So have a great rest of your evening. Take care, and we will see you all next time.